We're back with Janae Luciani, who almost lost her life to a pulmonary embolism, a dangerous side effect from her birth control.
Also joining us is her doctor, pulmonologist, Dr. Claudia Felberg. Thank you both for being here. Good to have you. And Dr. Felberg, the first question that you asked, or one of the first questions that you asked Janae was, are you over 35 and on birth control? Why in your practice was that one of the first things to come to mind?
With her symptoms, it is very worrisome when somebody has chest pain and has been on birth control and is over the age of 35. We worry that they could have had a clot. And without trying to worry her, that was the first thing that came to my mind.
For women who take birth control and the pill, usually, you get warned, are you a smoker? You could be at risk for blood clots. Clearly she wasn't. She was in the greatest shape of her life, and she didn't have these common risk factors. So why did you believe that this was happening to her?
So the incidence of pulmonary embolism increases significantly on birth control pill, and she happens to have a gene that also makes her predisposed to having this pulmonary embolism.
Statistically speaking, how common is that?
Pulmonary embolism is a very common disease. It is known as a silent killer. It is the #1 cause of sudden death. And we really underdiagnose it a lot. We really need to be aware of the situation to know that this is happening.
Janae, had you ever heard about this side effect and the gene itself? Did you know
No,
about
I've never heard of such a thing at all. I was actually on the pill for most of my 20s. I've had surgeries. I had a child. All of these things that I was at risk for getting a clot, and it never happened to me. So, it happened now. So it's really crazy.
Yeah, I mean, that's true. You had a child, and usually the first thing they ask is, do you clot?
Oh, they run every test in the book.
Yeah.
And unfortunately, depending on which parent it came from, or it could come from both parents, you necessarily wouldn't know unless they had an issue.
Yeah.
We're both raising daughters, and so we're both going to have this conversation with their doctors at some point in their lives.
Yeah.
But it seems like birth control is prescribed very offhandedly, just as a matter of course. Dr. Felberg, do you feel like this conversation should be more present when someone's prescribing birth control for a patient?
Absolutely. We do not test the general population for factor V Leiden or any of the other genetic predispositions. However, we know they're there and we know that the incidence increases. It is very important for the doctor that's prescribing these pills to talk to you about your family history. Ask very specific questions. Has anybody had a clot? Has anybody had a sudden death syndrome? Something that you don't know about. They have to be very clear with you because it is a very, very increased fall in the incidence of pulmonary embolism.
And could this happen at any age? Does it have to happen in your 30s?
It could happen at any age. It significantly increases after the age of 35.
Wow.
And also for anyone who's on hormone replacement therapy as well, it's the estrogen,
Correct.
so it's not exclusively birth control.
Correct. It's not exclusively the birth control. It's any estrogen replacement that can cause this.
Interesting.
So Janae, by telling your story for those out there who are taking the pill, which is very common, what would you like them to take away from hearing your story?
Don't wait. Listen to your body. If you're having some sort of symptoms, you know better than anyone. Don't wait to go to the doctor. Listen to your body and go get checked out. Because I think as parents, we always think of everyone else first. And so, in that case, I was thinking of my daughter and scaring her. And I always like to use the analogy about, when you're in an airplane and the oxygen mask drops and they tell you put it on yourself first and then, save your children or the people that are with you. And that's really important to remember, especially in this type of situation. Had I waited, it could have turned out so much worse.
Right, and we're so happy you're here to tell your story too.
And Dr. Felberg, is there anything that women can do to lower their risk of clots and embolism? I
think being in good shape, not smoking, certainly pulmonary embolism increases if your BMI, which is your body mass index, is greater than 29. So obesity is another risk factor. Being in good health is good, but please, by all means, if you have any symptoms, you have to come in and see your doctor. You can't wait. You can't think it's nothing. Let us be the judge of whether we think it's nothing or something that we need to worry about.
Well, thank you both so much.
Such an
important
amazing
information,
story.
right?
Yeah, thank you very much for sharing. And stay with us. We're going to be right back.